This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to answer the question, how to become an orthopedic surgeon. Before I answer that, you need to decide, do you want to become an orthopedic surgeon? And it's a super cool job and I love it, but there's a lot of orthopedic surgeons who are very miserable. So what I would say you should do is, if you're really considering this, is find one in your community and ask to shadow them and just follow them around the operating room, around the office all day, and see if that's the end game. See if that's something that you would want to do. And then ask them if they could go back in time, whether they do it again, and ask multiple ones. I mean, if you're getting, just see how it goes and see how you feel based on that. Because before telling you how to do it, you should decide whether you want to do it. Because the last thing you want to do is get partway through residency, decide you hate it, and then leave and you've wasted years of your life. And I've seen that. I've definitely seen that. Or you get farther out and you're an attending now and then you hate it too. You don't want to be in that position. So do yourself a favor early on and find out if this is something you want to do. I personally like it, but my practice is a little different than most. So how do you become an orthopedic surgeon? You've decided you want to do it. You've shadowed them. You think this is a great profession, which it is, and you want to help people and you want to do the right thing. All right, the first thing is you got to go to college and take pre-med courses, which usually include some biology, chemistry, organic chemistry, and physics. And then you have to take this thing called the MCAT, or the Medical College Admissions Test. And you also it's getting pretty competitive, so you also want to do some, probably research as well, or spend some time volunteering in the hospital. Just have a well-rounded application, and by and large, make sure you get your GPA good. It's got to be pretty high. If that means an easier major, well, that's a decision for you to make. My major wasn't easy. My GPA suffered a little bit because of it. It worked out for me, but just know that you can have a math major from MIT with a 3.2, and they're not going to value that as much as a 4.0 in biology from Valparaiso University, which is in Indiana. So just be aware of that, and then if you do have the well-rounded application, you apply, you get into medical school. Wonderful. Medical school is then 4 years. First 2 years are mostly studying, and the last 2 years are mostly clinical. During the latter part of your third year, you can start deciding like, hey, I want to do orthopedics, and then you can apply for orthopedic surgery residency. A lot of people will do rotations called away rotations, where they rotate at an orthopedic or other hospital that has orthopedics or another program apart from their own. That'll get you some extra interviews. And there's a whole art to interviewing and applying and all that. So you apply for that, and then you'll find out during March of your fourth year, which is of medical school, which is a super scary day called match day, whether you match or not. And assuming you did, well, now you get a spot in orthopedic surgery residency. It's like a deployment. They just kind of, you interview places, you rank them, they rank you, and you're just sent somewhere based on your rank list. I mean, you may be at the top of your rank list or your bottom. I ended up in Toledo, Ohio, and I thought it was great, but not everybody has a great experience where they go. So you've already done 4 years of college or less, 4 years of medical school, now you start residency. This will probably be some of the busiest time of your entire life, and it's 5 years long. But you learn a lot. And I didn't dislike my residency, but it is a pretty brutal existence. After you complete those 5 years, you have the choice to do an optional 1-year fellowship. That means you can do it in spine, or sports medicine, or joint replacement. You don't have to do it. I didn't do a fellowship, or I haven't completed a fellowship. But it's definitely an option. Most people do it, although you definitely don't need to do it. And then after that, you're out. Then you can kind of get a job and start working. So, I mean, you're talking 4 years of medical school, 4 years of 4 years of college, 4 years of medical school, and 5 years of residency. What is that? 13 years plus a fellowship would be 14 years. So, I think I did that right. That's kind of what you're looking at before you even start. And people have medical debt, so just really make sure you like it before you do it. And that's pretty much how you become an orthopedic surgeon. There's board certification, which is a different process, but I wouldn't worry about that. So let me know if you have any questions I didn't answer, and I'll be happy to respond below. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.